She is a Vice Dean of Mansoura Faculty of Medicine. Today, she will speak about one of the important issues that we should learn by heart: infection control in hemodialysis unit. Professor Nesreen.
Thanks for this nice introduction, Professor. And I hope that you will enjoy this nice presentation at the clinic. This will be the goals of the lecture: the hemodialysis design, the healthcare associated infection, the infection in the hemodialysis patient, and then the infection control practice. Hemodialysis unit design. What do you think? Is the infection control has a role in the design of the unit or the design of healthcare setting as usual? Do you think? Yes. Dating 1854 on also on nursing, it's reported that the very first requirement in a hospital is that it should do the sick no harm. And this is the theme or the logo of the Patient Safety Association now, but it's all story. Again, the American Institute of Architects guideline stated the importance of the role of the infection control personnel in the construction and the renovation of any healthcare setting. Not only this, he should calculate what's known as ICRA, Infection Control Risk Assessment. This means that every patient having certain service, we should calculate the risk that he will face. And so we will apply the infection control practice according to his situation. It is like a mathematical equation. The aim is to have safe situation for the patient and the healthcare worker. We should mention that the healthcare worker can carry the risk of having infection by contact with the patient or working in the hospital. First, the unit should be comfortable for the patient. It will be like a second home. He visits it 3 times per week and meets the same stuff as usual for a long time until he will move to the transplantation. We'll be lucky to have the transplantation. The location of the unit should be at the edge of the neonatal unit, adjacent to other areas within the renal unit, and easily accessible to other departments like radiology, laboratory medicine, gynecology. Why? What do you think that he will be closer to all these points? For avoid transmission of the infection from him to the others and from the other to him. Minimize the movement of the patient in the hospital. He should not be in second, third, fourth floor. He will use the elevator, and the elevator can, a lot of people can go on. This is a immunocompromised patient, so he can take the infection. So minimize the movement and limit the cycle where the patient can move. When I look at the infection control personnel in the healthcare setting, I should take a look for important things. First, after the design and sharing with the team, I should take a look for the hand washing facility. It's very, very critical. We should have 1 every 2 stations. And other application said it would be 1 every 4 stations according to your situation. And every station should have the lotion soap, the basin, and the towel dispenser, the waste pen, and should have the alcohol gel dispenser and the shampoo container. We should take a look at all these points. The ventilation. The ventilation is very important in every healthcare setting. For the hemodialysis unit, the rate of ventilation differs. If it is under reconstruction or renovation or already settled. If there is reconstruction in the unit or around, we should have 12 air change per hour, ACH. 12 air change per hour. But if it is already settled, just enough, we have 6 air change per hour. Okay? The station distance should be 3 feet or more on both sides, from 3 to 6. Why this measurement? For the droplet molecule of the pathogen, it cannot move more than 3 feet. After that, it will be settled in the environment. So the space should be wide enough to avoid the transmission of the droplet infection. The floor should be sleep resistant and easily cleanable. We are dealing with patients with blood-borne pathogen, blood escaping, so the floor should be easily clean, not to have a stain, because this problem with the stain or the blood in the floor. The renal unit should have isolation room, especially if you are dealing with tuberculous patient. You should have airborne isolation room with at least 100 square feet. I should check for the clean and dirty duty room, check for the maintenance room, for the equipment storage. It's very important to take care of the environment all around. In addition, the staff room, the bathroom, everything carries the risk of the transmission of the infection is very important, and you will see what are the points of interest when seeing in the hospital. Healthcare hospital infection, previously it's called hospital acquired infection, but nowadays it changed. Any place gave the healthcare service can carry the risk of having infection. Means the outpatient clinic, the private, the home. If you have a patient at home, it's healthcare setting because you give him healthcare. He's comatose, will have post-surgery and so. So the term is human. For the infection to happen, there is something known as a chain of infection. Starting from the pathogen, the pathogen should be present in the reservoir, either the human being, patient or healthcare worker, or the environment around the patient, or animal or plants that is raised in the hospital. Once it's in the reservoir, he should have a place to enter, port of entry, then mode of transmission, exit, and then goes to the susceptible host. The aim of infection control is to cut this cycle. Where we can cut the reservoir, we can cut the port of entry, the mode of transmission, and the exit, and also infectious agent. But we cannot cut the patient, right? The patient is immunocompromised, we need treatment, so we can cut all the cycle without touching the patient. Only we can use the immunity and protect him. What about the mode of transmission? In all healthcare settings, no focus on dialysis unit now, we have 5 modes of transmission. The contact, which is a major mode of transmission in all healthcare settings, followed by droplet, then airborne. Both droplet and airborne are common with the respiratory pathogen. But the difference is the size of the molecule. If the molecule of the pathogen is less than 5 micron, so it can float and spread in the environment long time than the droplet. The droplet is heavy molecule after time twister in the environment. But for airborne, it can disperse all around for longer time. So the patient with airborne infection require isolation in a special room, a special precaution. There is a common vehicle, means if thermometer or the blood pressure, the cuff, anything that we can share with the hospital and medical equipment. Lastly, the vector board, again, it is rare in the hospital because the hospital should have a closed window and the insecticide protocol is rare. This very important slide, the survival of the pathogen from the environment. This is very critical, we should know, because it is the cause of the spreading of many pathogens either in the community or in the healthcare. For the hepatitis B, it can stay up to 1 week. For C, up to 3 weeks. The influenza, 1 to 2 days. MRSA from days to months, and also VRE, vancomycin resistant enterococci, the score up to 5 months. This duration differs according to the degree of temperature of the inside the environment, the degree of humidity, the type of the textile or the floor the virus come on, and the viral load, depending also on the viral load. It's a critical situation because the environment all around can carry the risk of infection, whatever you give the service, even at home. What about in the hemodialysis patient? As mentioned before, the infection is the second cause of death. It is reported in 2009, and is still up to this moment after the cardiac problem. The most common site of infection is the vascular access, followed by wound, and then lung, and then reaching out. What is the source of infection in hemodialysis unit? Due to procedure. The procedure common through the process of hemodialysis, so we are going to the vascular access problem and the dialysate water, or between the patient through the contact, patient with blood-borne pathogen or the droplet infection, also carry the risk of transmission of the infection. We are afraid from special type of patient who has both the infection drainage should be completely covered, or if he has fecal incontinence or uncontrolled diarrhea, because we are afraid from having urological deficit. And as we mentioned before, the urological deficit can withstand in the environment up to months being exfoliated bacteria. What are the risk factors for the infection? Something coming to the patient, from the environment, and the hospital. I regard the hemodialysis unit. The patient is immunocompromised, frequent goes and visit the hospital, and move to the surgery or the OR, have prolonged blood exposure, risk factor for the patient. For the environment, his close proximity to surrounding, another patient with infectious disease, another healthcare worker, or the environment. In the hospital, the problem with the infection is failure to follow the guideline or policies of infection control. This is the main cause of risk factor, especially in the hemodialysis unit. Let the infection be the second cause of death. It's worldwide, not only in different and different countries, but the ratio different. So the source, okay. The failure can be described as follows. The staff caring for multiple patients. Actually, the ratio should be 1:1. One nurse for every one patient. And the problem is the movement of the nurse. Sometimes they shift, and maybe they have another work with more salaries, so she move. So we can use another one with another training. So this will be drop the process of the implementation of the infection control. The risk for spreading of blood-borne pathogens is a huge problem. And there is a lot of potential blood exposure with the immunocompromised patient. This may be a problem with the implementation of the infection control in most of the hospitals. This is the same slide, the source of transmission of the infection, your role after that, it's contact transmission. This is a problem again at the airport. Droplet infection could be like influenza virus infection, while airborne is common TB and measles. What are the infection control practices required to be implemented in the hemodialysis unit? It's a complicated process. First, we have a basic for the infection control practice. First one is the standard precaution. The standard precaution is applied for any healthcare worker dealing with the patient blood or body fluid. These standards should be applied. We have an important words in our expertise that if the blood proven is negative for any infection, but treat the patient and he has infectious disease, because we don't know what is the blood carrying. We have no idea that the avian influenza will come, nor the Ebola will come, nor the SARS will come. So the blood and the body fluid of the patient can carry undiagnosed microbes, can face little complication after that or certain symptoms. So treat any patient with blood antibody fluid with a standard precaution, which means the hand hygiene, the personal protective equipment, safety injection, the waste disposal, and the environmental cleaning, like general. We have important precaution, also the contact precaution, if we are dealing with a patient afraid from transmitting the infection by hand only. For example, the case of diarrhea. In this situation, is in general. We put this paper on the room of the patient to advise the nurse and the healthcare worker what they should do. And this is for the airborne. Is isolation. All these points, the 10 points, are the infection control practice to be applied for the hemodialysis unit. In my opinion, everyone should have special lecture. But I'm trying to summarize the important point and then let the time for discussion. First one, the hand hygiene. The hand hygiene is the most important infection prevention maneuver in Sweden. Because if you look for this slide, the hand can carry a lot of pathogen. And the slide with the blood agar, with the handprint, the nurse did all her activity, and we make a print on a blood agar. Look for this yellow spot. Those are staphylococcus aureus and epidermis. So how much pathogen you can carry in your hand? The WHO recommends 6 steps for hand hygiene. We should follow them. Because if you not follow them, there is important point in your hand can be missed. And this missed point can be a source of infection. Another, the hand hygiene is a broad term. Include the hand wash and the alcohol rub and the hand scrub. This is the hand wash and this alcohol rub. The alcohol rub is quick and easy and prevents the allergy that can come from repeated washing by hand and soap. The alcohol rub is better also than hand washing because the hand washing needs a lot of facility, but the alcohol rub it can be dispensed in the wall or you can put it in your pocket. So most of the healthcare workers now using the alcohol hand hygiene, except if the hand is completely soiled. If you see that your hand is obvious, it's not clean, you should wash first by antiseptic solution, then apply the alcohol gel. Because the bioburden on the hand prevents the effect of alcohol on the pathogen. You should clean it first, then put the alcohol rub. This is the 5 moments of hand hygiene by WHO. Could you repeat that something? Our people or our big book to be followed for the infection control are the EPIC, Association of Professional Infection Control, and the CDC and WHO. They put this nice table for hand hygiene, and look, there is some difference, little bit of difference. For WHO, there are 5 steps, but CDC and EPIC mention it's 6 steps. The last one is after gloves are removed, we should do hand hygiene. And for CDC and WHO, it's so sophisticated. Means that you make hand hygiene before touching the patient, and also if you are starting to make a septic technique, wash your hand another time. But for EPIC, it's only before touching and start, but the important thing is after removing the glove. A very nice publication, you will see next slide, that they calculate that if we follow the EPIC or CDC for a patient in the hemodialysis unit, and we will wash our hand according to this schedule, they calculated that if you are caring by 2 to 3 patients, you will wash your hand from 60 to 100 times. It's a limitation. I think if you read this may make you lack of confidence to wash your hands. It's too risky. How could be I wash my hand by all this number? But before reading this slide, also most of the country reported lack of compliance with hand hygiene, and it reached from 80% to 40%. Why you refuse to wash your hand? May I ask why? You wash your hands regularly by WHO 5 times. Emergency, yeah. One very good question. Case of emergency, I'm in a hurry, but not excuse. Maybe lack of facility. You should ask for the basin and the washing facility, even ask them to have the alcohol-based rub. What else? I am busy. I'm afraid to wash my hands because for the skin allergy. All these points are published. Lack of compliance with hand hygiene. It's not something new. So they try to improve the compliance by repeated education and make workshop. They ask the healthcare worker in the workshop to work all around and touch everything around and ask everyone to print his hand on the blood agar. Next day, when they saw the blood agar and the fingerprint and the organism, they thought, oh, I will transmit the infection to my house. If I have a baby, if I'm an old woman, so it will be risky. So I should wash my hands. So the continuous education about the importance of the hand hygiene and to make campaign for hand hygiene in the facility should be done regularly. The chief of the hospital want to know what is the problem, so we start to make observation. The observation of the health worker about the hand hygiene. They make it by several methods. The second one is the audit tool. They distribute a sheet from the CDC and someone observe your activity and report. This will be the task in the upper one slide. The task because it will be small population and you cannot judge all the people and expensive, a lot of people to be distributed. Something recent to observe for the compliance with hand hygiene, it's something fantastic we will see. 2016 publication noticed that they start to make a video close to the hand washing facility and observe how many times, even Spencer or hand hygiene, how many times this doctor wash his hand. And at the end, they make like something award for the best one who follows the suitable number of hand hygiene among observation service. Another fine things also, there is now iPhone touch application for the infection control professional. It's application on the Apple. At the end of your day, you will upload how many times I wash my hand before or after, and at the end of the day, I can calculate, or at the end of the month, I can calculate, and all this data will go to the chief of the hospital. So we can calculate how much I follow the WHO guideline. The last one, something nice. The last one, that they have real-time location service, like a badge or the wrist bandage, and once you move all around and wash your hand, it makes like alarm. And it can store up to from 10 to 50,000 applications for hand hygiene per month. And at the end, they also some American trial. But it's very expensive, but it is something new. What's new? New is to prevent the lack of compliance. Some important points that I did in the application. So we need to know what is we want to make. So this is another one application to observe the lack of compliance. The personal protective equipment. It's very, very important to know it's our barrier. This barrier protects you and to protect the patient. We have the glove. The glove should be, according to the CDC protocol, they reported that the glove should be used if you touch the intact skin of the patient or the environment. Intact skin. But the EPIC reported that this will be consumable. So the intact skin is not a point of problem. Since I make hand hygiene, no need to have the glove. So they reported that the glove should be where if there is mild soiling of the surrounding environment, if you see blood on the place, if you will touch the any blood or body fluid, so wear the glove. The gown should be semi-permeable. You wear it if there is a possibility to have a splash of blood. The uniform can be colonized. The doctor can be colonized by the bacteria. It's reported about 70% of the doctor have bacterial colonization, either MRSA or mycorrhizal bacterial. So the uniform should be clean daily and don't go out of the unit and move around. For the face mask and eye protection, this is very important if you are dealing with splashing of blood. And if you have the face mask, the face shield, the mask should be used under the face shield because you will can catch droplet infection and you are protect the mucous membrane by the face shield. Both are used. When I use the respirator, I will deal with airborne transmitted disease. If a patient with TB, I should wear the respirator. And what about the patient? Should he wear the respirator? Tuberculosis patient.
Yes.
When?
It is coughing.
Actually, the tuberculosis patient should be isolated in the airborne isolation room. Once he isolated in this room, he should not use the respirator because it has negative pressure and all the droplets get out from the hemophilia. But for the doctor to go in and out, he should use the respirator. If the patient comes out of this room, he should use the respirator. But inside the room, with the suitable situation and the ventilation, not use it. Use the person, as I mentioned before, that during initiation, termination, cleaning, handling. Once you look at dirty, you should change it fast. As I told you, that colonization by bacteria is okay. This is what's the reason about personal protective equipment. I give you some notes about the hand hygiene. What's the reason about the personal protective equipment? The problem with the personal protective equipment is it could be a source of infection in the hospital. If we don't make proper